move on to this disturbing story now. A policeman who was shot at New Somerset Hospital in Cape Town last night has now died. This brings the death toll to 3. The officer was escorting a suspect when another man grabbed his gun and opened fire. 2 patients were killed on the scene as well. The police officer died in hospital overnight. We've got Western Cape Premier Alan Winde, who joins us now to perhaps give us further details of that incident, which has now led to the death of a police officer and 2 other patients. Premier, many thanks for your time this morning. Just based on your engagements with various stakeholders, those at the hospital, perhaps some law enforcement officials, what exactly are the circumstances that led to the incident where 3 people have now died at the hospital?
Yeah, good morning and thank you very much. And as you said, it's very disturbing, very shocking. It happened around 7 o'clock last night. I got there sort of an hour later. The investigation is happening. I met with SAPS officials last night. Just after I'd left last night, the police commissioner had also arrived, so the forensics teams were already there. I think, as you said, there was a police officer in a next-door ward, in actual fact, looking after a patient in that ward. There was an altercation in the next ward. The police officer went to go to the next ward to see what could be done with the altercation. And I haven't got the full detail of exactly how it happened. They're busy investigating at the moment, tracking the coverage on the camera systems, etc. But the police officer had his gun taken away from him. The police officer shot. And 2 patients. Tragically, 2 patients and a police officer now, as you say, have lost their lives, and really is very, very disturbing. I must say that the medical staff obviously traumatized, but the real hero of the evening was the nursing sister in charge. She was the one that managed to calm down the shooter because there were other patients in the same ward. They managed to sedate the shooter, get the firearm away from him, and of course then give those patients counseling, get them to a different ward. But yeah, very, very disturbing and very upsetting that patients have lost their lives in a hospital where we are caring for them. And of course, as you said, the police officer also was immediately taken in to surgery. But in the early hours of this morning passed away as well. So very sad, and condolences to the families. And we're waiting now for the outcome of the investigation, how it happened, why it happened. Obviously no one's allowed firearms inside a hospital except a police officer. But how does a police officer have his firearm taken away from him? So that's what's happening in the investigation at the moment.
Premier, what do we understand about the shooter? Was he a patient at the hospital? Was he a criminal? What do we understand about the shooter who was at the hospital and carried out this awful deed?
So all I know is that the shooter himself was a patient at the hospital. In actual fact, the patient had been discharged but hadn't been collected yet. They were just waiting for the ambulance, which was going to take him back home again. And so it was the patient was waiting, and this is the same patient that actually got the firearm away. So further detail to that I'm not sure of, but of course the patient was had been discharged. So the police last night, in engaging with the police, they obviously have now arrested the individual. I presume that he's in custody, but as I said, the investigation is ongoing. It's in the hands of the South African Police Services now.
According to your engagement with the staff, Premier, is the hospital fully functional? Have there been any impediments to services provided to patients because of the incident?
No, absolutely. Immediately, I engaged with medical staff last night. The patients and the staff that were in and around this terrible occurrence, they were dealt with immediately. From any psychosocial support, we moved the patients that were in that ward, in and around that ward, to different floors in the hospital. The nursing staff also receiving counselling both last night and this morning. the sort of medical staff in charge, making sure that if there was any need, they diverted patients to other hospitals that were maybe coming in. So they were diverted. So the whole health system was managing properly. I mean, there were health management there last night doing that. Minister Mbombo, the Health and Wellness MEC, was on the scene this morning, as well as Minister Regan, the Police Oversight and Community Safety MEC. He was also on site this morning, both of them. And the report back now, again, further support to the staff, and of course making sure that the patients are looked after, feel safe, and receive the support that they need. Obviously being in and around such a traumatic incident.
No, absolutely. Premier, are you having any engagements about how we prevent incidents of this nature happening in the future? Do we need an increased security at the facility? What needs to be done? Are you having those conversations on how we prevent this happening again?
So, I discussed this last night with the police commissioner, but we need to get the investigation done. And of course, we'll use that data and that detail to say what could have been done to avert this kind of thing. I think, as I said earlier, no firearms are allowed into a hospital, except obviously if a police officer doing their job. So we need to interrogate that. We need to ask questions, and of course that will come, but they need to complete the investigation first, and then we will have a look and see. It is an issue that I think we speak about every now and again, because we're seeing, the increased pressure on our hospital system, especially on a number of our hospitals that face pressure from gang violence. And, we have already got quite serious security at our hospitals. But we're going to definitely have to ask ourselves those questions. How does this kind of thing happen? What can we do to make sure it never, ever happens again?
And finally, and very briefly, if you could, Premier, will the provincial government be assisting the affected families in any way as they lay their loved ones to rest?
Yeah, I'm not too sure of that detail as yet. Last night, obviously, that was key. How do we inform the families? And there was a team busy doing that last night while I was there. And of course, also informing the police officer's family, which then sadly wasn't just a shooting incident, was then passed away in the early hours. So we do have a team that were busy with that. Obviously, that engagement will be happening probably today and tomorrow.
No, absolutely. Premier Alan Winde, thank you very much for your time this morning. The Premier, they're just giving us some details of that shooting incident at the at the hospital yesterday, and really just a way forward and making sure that it does not happen once again.